All right.
Okay. Welcome, everyone. We're so glad you could be here for Mapping and Engaging Systemic Racism in Your Community. I'm Mary Francis with FaithX, and joining us today will be Ken Howard, who will be our main presenter, and then Steve Matthews, who's also co-hosting today. We have with us Reverend Sheldon Hamlin from St. Paul's Church in the village of Flatbush in Brooklyn, New York. So we're going to be able to use an actual congregation in an urban setting as a live example for the data that we are digging into. So here's what our time looks like for today. We're in the middle of introductions and the overview right now. Then we'll dig into the data, looking at systemic racism and how we can map it with demographic information and data. And then we'll talk about how to engage it and have some time for Q&A, and then look at some of resources available to you at the end. If you signed up to have maps done for your congregation, don't worry, we'll reach out to you, make sure we have your accurate address and information. If you didn't sign up for that, and you decide that you want it at the end, you can let us know. You can email us, and we'll make that available to you.
And this is being recorded, so.
This is being recorded, and we send out the recording to all paid participants after. All right, Ken, can you turn it?
So it's somewhat ironic that when we launched FaithX about 4 years ago, we discerned our mission to be helping congregations survive and thrive in turbulent times. But little did we know how prophetic those words were going to be, or how soon that things were going to be as turbulent as they are now, with three different kinds of crises going on at once: pandemic, which we're all dealing with, economic collapse, which we're still trying to recover from, and societal upheaval, which erupted earlier this year with the murder of an unarmed Black man, George Floyd, by a policeman, and the systemic racism that it represented. In effect, the ongoing murders of people by police. So, what is systemic racism? Just so we're on the same page. Systemic racism is when a social system is structured in such a way as to systematically disadvantage a particular race or ethnic group. In this case, Black people, but it could be others as well. Frequently happens with Latinos and so on. It's also called structural racism because it's built into the structure of the system. So it's real. It really is real. I mean, it always surprises me when people think it's not, but in the work we do at FaithX, helping congregations to learn about their neighborhoods and engage with their neighborhoods more effectively, we see its effects over and over and over again. And it's just too plain and just too often to be a coincidence. I think we figured out once that the odds of the kind of things we're seeing happening at the same time to the same neighborhood are over 8 billion to 1. So let's jump into it today with, we'll start by mapping systemic racism. And for our case story, we're going to be using St. Paul's in the village Flatbush in Brooklyn. And Sheldon is going to be our person on the ground who will be commenting as we go. By the way, all the maps that we use in this presentation were created by a tool that we use called Mapdash for Faith Communities. So before I bring Sheldon in, I want to talk a little bit about redlining. You hear the term a lot, but it's actually a historical thing that was established by Congress back in 1933 with its establishment of the Homeowners Loan Corporation, or HOLC. So in theory, its purpose was to promote urban renewal by designating areas in which housing loans could support redevelopment, ostensibly by rating them by risk level. And so they color coded them and gave them an alphabetic initial there. And so the green is best, the blue is still desirable, yellow or C is declining, and red is hazardous. And you can see how they play out into specific neighborhoods. So maybe it may have had good intentions, but in practice, it became a form of housing discrimination and economic discrimination. What ended up happening is that higher income whites were steered to the green and the blue areas, lower income whites were steered to the yellow areas, and blacks and other minorities were steered to red areas. And so you can just take a look here. On the left is the historic redlining. And now, 90 years later, this is where the people are. African American and other blacks here, Asian here, Hispanic over here, and white people here, and over here, more Hispanic over here. But you see how it follows very closely the historic labeling and the redlining, and it's continuing to have an impact even to this day. So we're going to run through about a dozen and a half different impacts that this is still having today. And I'm going to ask Sheldon from time to time to jump in as we go through these. And we'll get him to comment on how closely this reflects his experience. So we're starting here with food deserts. So there's the area, and there is where the food deserts are. So you can see that there's quite a number of them in the African American neighborhood there. Any comment on that, Sheldon?
Well, yes, and I would say what you're seeing, I think, Kenny, you correct me. We're talking about the major supermarket chains.
Yes, correct.
So the shop and stop. Could you point where this stop and shop is?
It's probably right.
Probably here.
Right here.
Right.
Yep.
But then we have, it was interesting when I saw this, there are other supermarkets, but they do not have, they're not, I don't think they're on the same level as shop and stop. And then ownership might also be a factor. A lot of the other supermarkets around here, I mean, there you have the Food Town and associated, but from when I go into them, the workers, it seems to me there are more minorities, Dominican from the Dominican Republic, and whereas the shop and stop, that's the only, I would say, major shopping chain in our area.
That would be right here.
Mm-hmm.
And again, we're talking supermarkets because what we're trying to look at with food deserts is not only the lack of a supermarket or the lack of a market of some kind, but the lack of good food available, nutritious food. So,
and then we also have, they call them in this community Korean vegetable markets. While a lot of the members and people around here shop at them, I tend to not shop at them because as far as I'm concerned, the food handling, you know, an example, the awnings which these vegetables are under, sometimes I could see pigeons and I could see pigeon drop-ins, and people are just going buying them. So the whole thing of access to good vegetables. So you would have to go to the Whole Foods or Trader Joe that is outside of this immediate area,
Okay.
or the organic store, which is a little bit more expensive.
Okay. So Sheldon asked me to look into health effects.
Yes.
So we found 3 or 4 of them. One is obesity. So there's the neighborhoods, and you can see that the disease prevalence of obesity is much higher over here. The darker the purple, the darker the prevalence. Also, high blood pressure.
Mhm.
And again, it's almost block for block. Whoopsie, what happened? There we go. Coronary heart disease. So there you are again.
We're not seeing the presentation, Ken.
Oh, you're
We're-
not?
Seems the screen share stopped.
All right, hang on a minute. Something weird happened. See it now?
Yes.
Yep.
All right. So here we are. Here's coronary heart disease. And you can see how that maps right over the same neighborhoods again. And interestingly enough, when you look at where the cardiologists are compared to where the heart disease is, they work in totally different areas compared to where the need is.
It would also be good to, and I would have to speak to some of the members of the church who are on the Zoom, and they're in healthcare, if they could give me a range, and I'll share it with you later, in the hospitals, where are most of the cardiologists coming from, whether they are in our neighborhoods or they're coming in.
Okay. And here's one that's very relevant to the current situation, COVID-19 vulnerability. The dark purple are the highest vulnerability. And there you see how this parallels the neighborhoods again. And highest in the African-American neighborhood here, and over in the Asian and Hispanic areas, less so in the white areas.
Ken, can you give us an idea of the square mile of the area we're looking at here in Brooklyn?
It's down here in the left-hand corner.
It's a little
So
small.
that's 1 mile. This is about maybe 3 miles
Okay.
from here to here, and this is maybe 4 miles over this way.
Okay.
So the whole area is maybe about a 10-mile area.
Thank you.
You're welcome. And looking at it from a slightly different area, here's medical insurance. And so the red areas are the ones with the least coverage, less than 80%. So here you see it again. It's pretty stark. Most of these are pretty stark. Rent burden was another one that Sheldon asked for. And you can see how that overlays here. So it's interesting with this one that you see it most strongly in the African-American neighborhood, over here in the Asian and Hispanic neighborhood, but it's also pretty high in this neighborhood that was one of the areas that were labeled C. So it was historically low-income whites here.
Mhm.
Any comments there, Sheldon?
I can say that now during COVID, the whole issue with rent is there've been several demonstrations. We've participated in 1 or 2 of them where persons were forcing elected officials to have a moratorium on rent.
Okay.
And
can you-
also mortgages for this, also for homeowners in
Yeah.
the same area.
Okay.
Ken, could you define rent burden?
Rent
Yeah,
burden
but-
is the percent of a person's income is going towards their, renting a house. So there would also be a mortgage burden too that we could get a hold of here. Although about 80% of people rent here. And so the dark red means that they're spending more than 50% of their income on rent.
Right. And what I would like to add is back in the late 90s, when the rents in Manhattan skyrocketed, persons left Manhattan and went to Park Slope. As the rents in Park Slope went up, you find persons started moving more to Flatbush and other areas. And with that, the prices have gone up. So an apartment around here before pre-COVID was going for like $2,700, $3,000 a month.
Well, how many bedrooms?
Some of them, the houses around, the apartment buildings around the church, around St. Paul's, for the most part, they are pretty good, high ceilings, some bedrooms, some of them have 4 or 3 bedrooms with 2.5 toilets, bathrooms. This area was once a very wealthy area. There are streets named after persons who used to attend St. Paul's Church. So it was a very well-to-do area when in 1836 and up until you had the White Flight. So the good buildings.
All right, next is workforce by class, kind of breaking down the workforce into creative class, service class, and working class, which service class usually being the lowest paying jobs and a little bit more vulnerable jobs. So here's the area, and here's workforce by class. Again, you can see that in the areas that we're talking about, most are service class.
Yep.
And related to that, of course, is disposable income. And you can see it follows a similar pattern. The brown areas are the darkest. Excuse me, the brown areas are the ones that have the lowest disposable income. These dark brown areas are 13.9 and under, and these lighter brown areas are 13.9 through 3,900. Any comment there?
No, that's pretty much, you're on point.
That's pretty much what you're seeing. Okay. So now switching to education, here's public education spending, which certainly has an impact.
It does.
White areas are the least spending by government on public education.
Yeah, the education in New York City, I am not pleased with. And, we had Bloomberg as our mayor. And what he did went into the public schools and allowed chartered schools to coexist in some of the public schools. And what I have found is that a lot of the charter schools, not all of them, but a lot of them in public schools are run by white or young male, white Caucasian males. And they do get a lot of subsidies from the federal government, the state, and what have you. And then what they have done is taken some of the I don't remember the bursaries from the parochial schools and given it to these charter schools. The charter schools go into the public schools, pull out the best students,
Best and the brightest.
the best and brightest students and put them in. And some of the parents, many of them coming from the West Indies, they fall for it because they want that academic rigor and uniforms and stuff like that. But then I have heard them, they're not pleased in the end with the progress of the children. So we have a problem in the school system. Before we had Blacks coming into this area, a lot of the public schools in New York City, they also had trade schools. And I understand some back in the 70s, they started to remove the trade schools. Not everyone is academically inclined. And so, you know, you take away that, a child going and is a slow learner, eventually is going to fall by the wayside. And so if you, in the map, we have high crime, we have gangs. And so education is lacking and something needs to be done.
And so we have the situation where you have the worst of both worlds. It's pulling out the best students and it's pulling out the money. So here's another thing that bears on education. This is households with no internet access. The darker the purple, the less access. Again, you know, pretty stark parallel.
When I came to St. Paul's in 2013, I had an epiphany moment. I thought everybody had internet access. And in talking to some of the students, they said, oh, I don't have internet. And that was a wake-up call for me.
Yep. So these really dark areas have more than 25% do not have internet. So that impacts, especially during COVID, that impacts their ability to be able to learn remotely. And this has, of course, has an impact on educational attainment, how far people are able to go in their education. And so looking at that, these areas that are the yellow areas are ones who had to stop at high school degree. Any comments there?
I just want to just to give persons idea of what is going on. Can you point to Prospect Park?
That here?
Right. And then I just want participants to realize beyond the marking going up, I guess right back here, come back down, where you see the reddish, that is Prospect Park West. And that is the more ritzy side of Prospect Park. And one of our senators, Schumer, he lives on here. He lives right on Prospect Park West.
So, and this was one of the A or green areas, you recall, in terms of the redlining. So these, when it says red like this, these are people with graduate degrees, and the blue is people with bachelor's degrees. So it definitely allowed them to go further because of where they were located. As somebody has said, I believe that you can tell how successful and how educated somebody's going to be able to be just by learning their zip code. Getting towards the end, here is crime rate. Red is, the dark red are 4 times the national average. So here we go. It's not quite the same overlap, but you see some real hotspots. Here, up here, and some, at least twice the national average over here. So any thoughts there?
Well, you know, I would say one of the poor education results in most part high crime rate. A lot of the crime that is happening in this area, young Black boys.
Okay. So it has a lot of reinforcement going on. So this is the last one we're going to look at, and this is police killings. So you see the areas. Now you see the police killings between the year 2000 to present, and you can see where they're located. The vast majority of them right here. Comments?
You're on point. What we should have included also is the black on black shootings, which is a result of the poor education and, you know.
Okay. So now we've gone through mapping it. We know where it is, what it is, and
Hey, Ken,
yes.
before you go forward, there was a question that were several questions back on the internet map.
Mm-hmm.
If you don't mind going back for there just a second. And the questions revolved around, is it a matter of internet access or affordability?
That I can't really say.
Well,
My
and-
guess, go ahead.
Can I think it would have been affordability.
Yeah, I was going to say indirectly. I mean, but we don't have anything that tells them about the affordability of the internet. But if you were to take this and lay it over disposable income, you'd see that that's the areas with the least disposable income are the ones without internet access.
Right.
So it probably is the cost. They're the ones that are spending more than half of their income on rent and probably the rest on food.
Yep.
Right. Ken, do you remember when we did that internet access piece for Epiphany in Tempe, Arizona? Yeah. And there was a whole neighborhood right next to the church where over 30% of people didn't have access to internet. And it was, I mean, they had fine internet at the church, but across the street in this neighborhood, it was low access. It was definitely about affordability. And so the church, like some churches are starting to offer free internet access in their parking lots, or they're working in the community to try to lower the rates for internet access because it is such an integral piece of our communities right now.
And it looks like you have the same situation here with St. Paul's, because on one side you have somewhat better internet access, but this whole area within the 5-minute drive time, which we like to call the ministry area, has pretty low internet access. And if you expand to maybe a 15-minute drive time, which would be where all the members come from, that would be somewhere about here. And it's still a big issue, it looks like, for a number of households in the congregation. Would that be right?
Right. And also we have a large, in this area, we have a large percentage of undocumented immigrants as well.
So, yeah. So once we've identified it, that's half the problem, is understanding that it's there and what kind of impact it's having. Then we need to figure out how we can engage it. And so what I want to do now with Sheldon, and then you guys can follow along in chat or bring up questions during the Q&A period, or make comments or recommendations. And what I want to do is to let Sheldon choose first the top 1, 2, or 3 issues that he sees based on what we've just gone through, and then kind of work through a process of thinking how we can engage that and address the problem. So we're going to start by showing what we call a neighborhood missional intelligence report. This is that 5-minute area around the church, 5-minute drive time. We could have done 15 minutes. We could have done 15-minute walk time. But this is what we chose for this. So just the things that I've outlined in red are the ones that are significantly above or below the national average. And so here's where we're looking at median household income and disposable income. Both of those are a good 20% below the national average.
Poverty.
And then you look over here, poverty, it's running at 17% versus 13% is the national average. Households receiving food stamps, it's about twice the national average. And here you see your service industry people, it's about 25% higher than the national average. And here you see the impact of that combination of high price and low income here in the 56.7% of people are paying, or that people on average are paying 56.7% of their income on mortgage. And that's compared to 15% nationwide. So it's the mortgage burden, if you will, here is like almost 4 times the national average. Another issue over here, when you look at the housing units, that's 84% of those are renters. And you know that even in normal times, a high level of renters means that there's a greater possibility of having a homeless problem, because it makes having a home somewhat vulnerable. In the 15-minute area, we also noted that about 10% are unoccupied, which also begins to be a problem. If you get over 10%, you get the beginnings of blight, which gets really hard to turn around. Low exercise, that probably also hits impacts on health. We know it does, because exercise, the ability and access to exercise is the most directly related thing we see to predicting ill health. And medical coverage. The national average is 74%, about 3/4, and this is 61%. Crime actually is lower than the national average by about 25%. But if you recall, when we were looking at the actual maps, there's a lot of hotspots that are like 4 times above. So it's specific neighborhoods have that, but the whole area does not. So out of what we've looked at, Sheldon, what would you say is the top 3 issues?
Housing, education, healthcare.
Say that again.
Housing, education, and healthcare.
Okay. Which would you say is the top, the very top?
Housing.
Challenge. Okay. So that's the first question. So let's start with that. So housing is the greatest challenge based on what? Affordability?
Affordability. And, again, as I said, this used to be a very well-to-do. A lot of the buildings are pre-war, so they have character and, big rooms, but they have been held by developers. And so, a developer, when he thinks he or she has made a kill, they sell it to another developer. And you have persons in these apartments for over 50 years, and I think we need to change, especially here in this city. We need to allow minorities or persons of color the opportunity to own their own homes. And that way they will be able to develop more disposable income.
Okay. So we just did the first question, what are the greatest challenges facing our community? The next step then is to look at what are the root causes and what are the current impacts related to that specific challenge. So what would you started to hit on that, on the root causes, but could you say more?
Could you be more specific? And you're talking about the housing piece, or?
The housing piece, in terms of the housing problem, what are some of the root causes of that? We know, for example, you just mentioned the disposable income being low. But,
And then another issue is gentrification.
okay.
So again, the people are coming in as they are priced out of Manhattan. They're priced out of Park Slope and Prospect Heights. They're coming to this area, and as they come to this area, those apartments are being priced out. You also have persons who are undocumented, and because they're undocumented, the owners would can force them out, and then we have low paying jobs.
Mhm. Okay. And then what are the current impacts of the housing issue that you're describing?
So we, as I said, we have, like, with the gentrification, a lot of new. It's not that we have a shortage of apartments, or it's a shortage. It's not a shortage. We have it, but affordability.
Mhm. Okay. So we've done the first two. After you've identified what are the causes and the impacts, you need to start brainstorming what strategies might address the root causes, what strategies might address the current impacts, because you have to do both at once.
Mhm.
So what kind of strategies do you think might be helpful in addressing the housing problem as you see it?
Well, one of the issues is that a lot of the local politicians, they are in the term, they are in bed with the big developers,
Hmm.
and therein lies the issue. And it is very hard to have them really take on the cause of the masses.
Hmm.
One of the things we at St. Paul's, under my leadership, we're doing is partnering with grassroots organizations
Hmm.
around housing and sensitizing our members. Um, a lot of our members do not necessarily live in the immediate area, and many of them have their own homes, so are not necessarily impacted. But the whole thing of being in solidarity, for me, is important.
Okay. So when you begin to think about this, then you have an idea of what strategies may be effective. You have to start thinking of what gifts, strengths, resources you can bring to bear. And they're not only from your own congregation. You often think that the problem that's out there is something that we need to deal with ourselves.
Mhm.
And we often don't look at what resources the community has itself, what other organizations, as Sheldon was mentioning, um, what other congregations can bring to the table. So what do you see, Sheldon, as the gifts, resources, strengths that can be brought from members of the community, from your congregation, or from other congregations or other organizations?
So, I believe that charity starts at home and you spread it abroad. And right now, I am really, I'm intentional in either retooling or re-educating our members, because all of this goes right back to the heart of the gospel.
Hmm.
And I believe for too long, we have allowed the government to do the work of what Jesus has called us to do. And so we have embarked on re-educating and retooling. And in the height of the Floyd, the Floyd marches and stuff, I believe that we needed to do something. And a lot of our members are from the West Indies, and their approach to racism and all that is happening is different. And you have to acknowledge that. And so knowing that, I needed to find a vehicle to get them on board. And so we read for the better part of the summer, The New Jim Crow by Michelle Alexander. And the hope was in reading that, it will lead us to something. And so we will be creating a racial justice ministry, a racial justice and reconciliation ministry that would help us to live into these issues that I address, the whole housing, education, healthcare.
Okay. What do you see other congregations might, what they might bring to the table, or other organizations?
Well, some of the organizations that we are partnering and some of the members who live around here are a part of, they are already out, they march, they go to Albany. And so I'm trying to piggyback on them and to form partnerships with them. New York Communities for Change. If I'm not sure if that rings a bell to you or anyone else so learning from them, the whole idea of community organizing. Jesus was perhaps the biggest community organizer, and yet most of our churches, we do not know how to organize around a social issue. And that is something that I am learning, and I'm hoping that more of our members will be able to learn from them, and we partner so we can address some of these issues.
Okay. And then this is an important step. What is God calling on our congregation to respond to? We're not called to fix everything that's out there.
Right.
We're called to discern what our part is, what God is calling us to. What is out there that is consistent with our vision and mission, or maybe how is God calling us to change our vision and mission? But in the end, it means, you have to be asking what your congregation is called to do, and that might be doing, but it also might be being a catalyst for something to happen. It might be collaborating with somebody else. So how do you see God calling your congregation?
At the end of it, it is about faithful service. That's my mantra, faithful service. And earlier in the pandemic, we were searching, like most other congregations, what do we do? We can't go into the building. And the Spirit said to me, hey, you and your congregation, you need to join the bandwagon and get out there and serve frontline and essential workers. And we started that. And I took pictures the first feeding, and I sent it out, and the comments I got and the contributions started to flow in. But then the numbers went down. And so from Holy Week, Monday, Thursday, Good Friday, right up to the last Friday in June, through the contributions of our members and friends of St. Paul's, that's what we did. But then we ended. But then as I walked around, as I read because of COVID, hunger was always with us, but it has gone up. And so we went back to the same restaurant that we purchased or catered the food from. And now every Wednesday, since the beginning of this month, every Wednesday, that restaurant makes for us soup, and we take it to a high traffic area, foot traffic, and that is Ocean Avenue and Parkside, entrance to Prospect Park. And we feed the hungry. not only the homeless, but the hungry. And I believe that out of this ministry, greater things will open up for St. Paul's Church and to help us to address these issues. We are relatively new to this sort of work, but nothing happens, I believe, in God's time. So faithful service to the people of God, I believe, is what God is calling us to do and to be.
So what will be your first step when you go back to church this afternoon?
Well, I'm at the church right now.
Oh, well, when you leave the church, go out into the world.
So, and we are preparing for the feeding for today.
All right.
And out of that feeding, the first 2 Wednesdays, members came to me and asked, Father, with all of these people, can't we do a feeding for Thanksgiving? I said, go for it. It's not coming from me now.
That's
It
good.
is coming up. And so I do believe that partnerships will be formed as more and more congregations and other organizations hear that this is what we are doing. And I am hoping that I'm not waiting on the politicians anymore. I am hoping that eventually St. Paul's will become a lab where we meet with various entities and we look at ways of how we can uplift our community. How can we help address the housing issue where those persons who are living in these buildings for over 60 years paying rent, how might we be able to help them to become owners and that they can pass it down to their children and grandchildren? How can we repair the education system? And right now it is not meeting the needs of all of our children. How can we get the trade schools back into our education system so those persons who are not academically inclined, they can do a trade? And in the summer months, depending on what level, they are given apprenticeships offerings so that when they graduate, they go on. That's what happened to me when I started out in graphic arts. I ended up going to work at one of the better newspaper companies. And then here I am. So if it worked for me, it could work for others.
Okay.
And then the health piece. Health is very important. I try to encourage my members to get out and walk. I'm not going to give up my West Indian food. Thanksgiving is coming next week. I want my macaroni and cheese. I want my pepper pot from the Guyanese. And right now, I'm just preparing my body to reduce some of my pounds so I can eat that food.
Well, thank you for that. I need to be sensitive to the time to allow some discussion and Q&A, but thank you, Sheldon. I was actually this was somewhat unfair to Sheldon that we were asking him to go through these steps, which you probably are going to need to take months.
Exactly.
And really.
But thank you. Thanks for pushing me.
Okay, no problem. So now I want to open it up to questions and discussions, and especially if people had ideas that they wanted to share with Sheldon about how they might answer some of these questions. So it's time for Q&A.
Some of you who have commented in the chat may want to comment verbally too, just to ask questions. I think there have been some really good comments made. One about just how systemic this is from Columbus, Ohio, where apartment complexes are owned by developers in LA, so they have very little incentive to keep track of what's happening in those neighborhoods. And so one of the things we can't map, but you can, are your community resources, the people in your churches and neighboring churches who sit on boards, to invite them into advocacy for your neighborhood. And so that's a way of beginning to chart local resources that I think can help address some of the issues at a higher level. Just wanted to point that out.
So anybody else have any ideas for Sheldon? If you were in issues, what would you do? Or if you have a similar problem where you are?
Hi, this is Jennifer Nelson. I'm a deacon in the Bay Area. Guyanese, thank you, Sheldon. Pepper pot, way to go. Cooked up rice.
Yeah.
Okay. We're finding a lot of the similar things that you have found. And I have relatives living in Flatbush. When I first came to the United States, that's where I went, Flatbush. And my relatives still live there. But it's like you said, so we are West Indian, whatever we've come. And yes, you know, my sister-in-law is a geriatric doctor there. My brother is a computer scientist there. However, we now that you've opened my eyes, we see it in the Bay Area. And one of the things you said that I will continue to emphasize is allyship. You said collaborative efforts, allyship. Get the people, as you're saying, are on the boards to see this. And another person commented on that in her 97% white areas in her church. She can show them the effects of what's happening in other areas. So I agree with allyship, just getting people on board there right now with issues, the current issues. People are willing. A lot of our white brothers and sisters are willing, are asking us, what can we do? These are some of the things we can do. Also, you said something again, getting with the local organizing bodies, like we do Genesis, which is a local affordable housing group that we ally with. And we're like, okay, we need to get to the city council people. And we go in there and we're listening to their meetings and stuff. So we're a part of it. Getting your congregation to understand that we need to be open to listening and going and being present to some of these city meetings that we have. I know it's hard because, as you know, as we immigrants move, you have to then work, and you're working double, triple time sometimes. But if you can, because we have a stake in this. Another thing you said that's so important is getting us, and I'm going to count myself in there, to understand that this is our country now, and we need to own that. We're not going to run back home. I have 2 Black young men who said to me, Mom, do we need to move? And I said, no. And I started, actually had a resolution on anti-lynching. We did a resolution on Juneteenth. I'm saying, we have to get involved. We have skin in the game, and we need to take ownership of that. This is now our country too, and we need to be a part of this. We're invested in here. We need to take ownership and be a part of it. Sorry to take so long.
Oh, that's okay. So anyone else have any questions or comments?
I do have a comment.
Yes. Yes, you do. Go ahead.
I live in a very, very white suburban community outside of the Pittsburgh area. And when our congregation got together, because we felt we had to do something, I'm part of a social justice ministry. We did have a number of educational and facilitated discussions to make sure people understood what systemic racism is. And it's led us to try to create more service projects, if you will, or partnering with people. And there may be some needs in our immediate area, but there's obviously needs in a greater spread. So I'm happy to say our congregation has responded, and they now realize what white privilege is. So there's education, and I wanted to do this mapping to see if we could create even more service projects with allies. And it's housing and education, and we've also discussed maybe some things about the prison system. And especially there's a high school for youths close to us that for youths that have gotten into trouble. So we thought there may be some things we could do as service projects there.
Now, what you saw here were just pictures of maps. We actually, when we work with congregations, we do that a number of ways with actual live maps, where we can provide a live neighborhood missional intelligence report that people can dig down into.
Right.
and let them look through all of those things. We do that a number of ways, just so that you know, in terms of the resources, that people can just get a neighborhood missional intelligence report, or they can get the neighborhood intelligence report plus an hour of our time to help them interpret it. Or we have a program where we actually, over several weeks, walk a congregation through all of this. That's called a neighborhood missional assessment. So we've tried to put this together in ways that people can get what they can afford.
Right.
We want to try and have some bite-sized pieces.
We will be following up.
Ken,
Yes.
what is missing from ours is the high rate of prison inmates,
Mm,
which is a result of the low education and,
yeah, I think there's a map for that,
okay.
but we only were able to do so many in the time that we have.
Okay.
Any final questions or comments from everybody? Anybody?
I have one.
Martha?
This is Martha Seaman. Actually, you mentioned my parish a little bit ago. I'm from Epiphany in Tempe, Arizona. And I guess my observation is, and wonder if this relates to some of the questions, is that, I get this sense, Sheldon, that because of the age of your parish, these changes emerged around you with obvious various influences. It occurs to me that some of our congregations probably located where they did because at a much later era, because these influences were already in place. In other words, they were seeking those communities that had that profile, and I think that's a question that we in new and newer and growing communities have to answer.
Well, okay, then we're just about out of time. I appreciate that, Martha.
Can I have a question?
Yes.
This is Marvin Hill, and I'm from the Chicagoland area. Is your mapping available for other areas other than the New York City
Oh,
area?
yeah. It's we have it nation.
Are you available in Chicago in that area?
Oh yeah. Oh yeah. And we can do this across the United States. Some of the we don't have. Well, let me just for newer communities, we probably won't have the 1933 redlining information. So it'll be basically starting with where what's the racial and ethnic predominance in certain neighborhoods, and then mapping it from there. But yes, we have it across the entire United States.
Thank you.
So that's a good segue. So I just put the questions, and there's also a worksheet that I'll be sending out to folks that they can use. And then just to go over the contact information about how you can get a hold of us. This is our website, faithx.net. You can reach any one of the three of us, me or Mary or Steve, by emailing info@faithx.net. We'll all get it. And if you want to get an idea of some of the resources and services we offer, or what other people have asked us to do for them, these are the resources and services. So resources here at bit.ly/faithx-resources, faithx-services, and faithx-our clients. So, and I put those in the chat as well. Mary or Steve, you want to say anything else before we?
I have a question. One
Yeah.
last question. When will you be getting the latest census data to use for your work?
Okay. Well, everything that we have, we try and get the most current data for everything that we have. And so for some things that means it's the last census update. But for other things that it's better than that. Like our information on unemployment, for example, is now updated monthly. So we have unemployment numbers up to May of this year. So we will have 2020. The census update for that won't happen until January, but then shortly after that, we'll have the latest. We'll have the 2020 data. Does that answer your question?
Yes, it does. Thank you.
Yeah, and just by the way, we gather this information from a lot of different sources, mostly census updates, but we also get access to marketing data. We collect and curate information from Health and Human Services, Department of Education. We get our church data, the location of churches from, of all places, Department of Homeland Security. So I guess they think that we're soft targets. So we try and as I said, what we basically do is we try and we don't put anything in the work that we do that is less than annually updated, and nothing that's less than what we think is about 80% accurate.
Thanks, everyone. We appreciate you coming. Thanks to Sheldon for your input and letting us use your church as a case study. Thanks, Ken, for your hard work in putting this together today. Thanks to all of you for continuing to learn and fight the good fight. So if you signed up for today and now after the fact say, oh, I wish I had clicked that option for the maps and resources, just email us at that info@faithx.net and we can help you out with that. So thanks so much for coming. Have a great day, everyone.
Take care.
Thank you all.
You're welcome.
Ken, will you stop the recording, please?
Yes.
That's great. Thanks.